Everybody's excited about the COVID-19 vaccine. Last Friday night, the U.S. Food and Drug Administration gave the final go-ahead to Pfizer and its partner, BioNTech, to start distributing its vaccine for the novel coronavirus. And trucks are rolling as I speak to distribution centers all around the United States. Dr. Anthony Fauci says that the country might be able to get back to normal by next summer or autumn, but it depends on how many people get vaccinated. But 42% of Americans in a Gallup poll last month say that they won't take the vaccine. And how will the vaccine be distributed exactly? By whom? How will its effectiveness be measured? Hi, I'm Frank Diamond, the managing editor of Infection Control Today, where we try to give infection preventionists and other healthcare professionals the information that they need to battle COVID-19. I just threw a lot of questions out there. Here to help us make sense of this is Dr. Bruce Y. Lee. Dr. Lee is an internationally known healthcare expert whose accomplishments can't be listed here because it would just take too long. By all means, Google him. Dr. Lee, thanks so much for joining us today.
Thank you for having me, Frank.
Okay, Dr. Lee, we've got the vaccine. What now?
Well, so getting the vaccine available is just one step along a long series of complex steps. So next, the vaccine needs to be produced. So we've seen shipments come out, meaning that the vaccine is being produced, but ultimately, you're going to have to produce a lot of the vaccine. So we're talking about millions upon millions of doses within a fairly short period of time, and that's not a small feat. So we'll have to see how production goes. And then there's the whole issue of transporting the vaccine. So normally transporting a vaccine is in itself complex because you really have to figure out how to get it through the series of steps called the supply chain, all the way to the places where it's going to be administered. And that includes a wide variety of places. You know, it could be hospitals, it could be clinics or health departments, but there may also be other locations such as schools or churches or what have you, or workplaces that aren't necessarily easily reachable by standard clinics and healthcare facilities. So that poses a major challenge for any type of vaccine, but especially for this vaccine because this vaccine requires special storage requirements. It needs to be stored at freezing temperatures, so wave freezing temperatures, not just below 0 centigrade or below 32 Fahrenheit, but super freeze conditions, negative 80, negative 90 degrees. And many facilities aren't already set up to handle that type of those types of temperatures, not just the facilities, but the transport devices and transport vehicles. So that needs to be addressed and addressed like throughout the country, because if you have certain locations that just don't have those facilities or don't have that equipment, they may not be able to handle the vaccine. Then there's the issue of, as you alluded to, vaccine acceptance. And we know that even with traditional vaccines that have been tested for years, that have been proven to be effective and safe, there can be the challenge in convincing people that it's the right thing to do to get vaccinated. We've seen over the past 2 decades emergence of very active and vocal anti-vaccination movements. And so people need to understand, all the data and all the science behind the effectiveness and the potential risks of this vaccine, because every product has some risks. The key is, whether the risks are high enough to justify concern. So that needs to be done. We really need to engage the public. And when I say engage the public, I don't mean just selected people or people who happen to read certain things. It has to be everyone, because if we're going to be able to control the pandemic, then every person matters. As long as the virus is still circulating somewhere, it's still a threat. And then keeping in mind the results. The results are early results, and they're from the initial months of the trial. So we still need to keep an eye on what happens with the clinical trial, because the decision was made by the FDA based on these initial results. And of course, they were weighing the risks and the benefits of the vaccine, but these trials are continuing. So we need to keep an eye on these things. So all professionals need to say, okay, let's look at the reports. Let's follow the scientific publications. And the other thing is now we're going to have other sets of data emerge. So when people get the vaccine, they presumably will be tracked. And so with vaccine surveillance systems in place, then we need to follow the data that emerges from that. And we also have to look at studies that may crop up here and there because people are getting more people are getting vaccinated with time, and see what they have to say. Science evolves and science emerges. So we're learning new things about this COVID-19 coronavirus each day, sometimes seemingly each hour. So we have to keep track of this news. So I know it's very tough, especially if you're a busy professional and you've got tons of things to do, you've got patients to see, etc. But it's really important that we find ways to keep people abreast of emerging news because things can change.
I have to ask you this question, and I'll probably ask this question of everybody I talk to from here on in. Are you going to get the vaccine?
So yeah, so that's a good question. So I think, there's the target group, which are initial frontline workers. I think it's important to really. So I've been carefully reviewing the data and what that has emerged, and I would like to see, there's still unanswered questions. So there are still questions about the duration of protection. There's still questions about how will efficacy hold up over as the risk of transmission goes up during the winter months, because there's increasing transmission during the colder months and when the relative humidity goes down. So one of the concerns that I've had is we want to make sure that the science and the data really justifies any conclusions that we have with the vaccine, and we just need to make sure that we see as much data as possible. I've always been a proponent of making sure that things, don't rush before you have enough information, and if you rush, then you potentially could cost time elsewhere. So sort of the tortoise and the hare situation. So, I would like to see data for a little longer periods of time to make sure that we have a better handle in terms of efficacy and the safety of the vaccine.
And when you say longer period of time, how long are you talking about?
Well, it'd be good to see it over the winter months, and also at least part of the winter months, and also it would be good to see, right now the safety data is over a 2-month period, so maybe over additional month or two would be helpful.
A lot of my readership, we cover a wide swath of healthcare professionals, but a core readership is comprised infection preventionists who, with a nursing background, often, I guess, depending on the facility and the hospital, they are involved in vaccination efforts at their hospitals. Not always, but often. So any advice for them as far as, well, let's even go higher. Any advice for hospital administrators as far as whether they're going to mandate that employees get this vaccine or not? I mean, can they legally do that, I wonder?
Well, I think there's several things. So one is, anytime anyone imposes a mandate, they need to follow it themselves as well. Mm-hmm. So, I think think about it this way: if you yourself are comfortable taking the vaccine, then if you want to impose a mandate, then you need to really feel comfortable yourself about taking the vaccine. It's not really very good optics to insist that others take it when you yourself are not taking it. It's a very complicated issue in terms of the mandate. I understand that, there's the concept of trying to protect the patients and make sure that, the virus doesn't spread. But there are other options right now to actually prevent the spread of the virus. Of course, personal protective equipment and social distancing, and those can't be forsaken in lieu of a vaccine. So this is very complex. So we need to have the layers of of precautions in place, and they need to continue even though the vaccine is available. And it's a combination of seeing, basically understanding how the virus is actually spreading in the communities and the facilities. I think one of the dangers is that there is optimistic news about the vaccine, but it's not as if once the vaccine rolls out that suddenly things will return to normal and that we can forsake all other types of infection prevention and control measures. So these are very complex issues, and we need to make sure of all these types of precautions are in place and how feasible all these layering may be in different facilities before talking about mandates. This needs to be really organized, and my concern is that we want to make sure things aren't rushed. Sure, the vaccine is available, as I mentioned, but we also want to make sure that we follow the data as it continues to emerge, and there's a balance in terms of risks and benefits. So for some folks that are on the front lines, it might be determined that the benefits really outweigh any of the uncertainty right now, and it's worthwhile taking the vaccine. And for others, maybe because there are other things in place, et cetera, then it's worthwhile to wait. So this needs to be done in a very organized manner, and there needs to be a complex strategy placed in because it's a complex situation in response. So I think broad mandates are we really have to kind of look at the risk-benefit ratio as well.
Right. Forgive me for asking a question with born of sketchy information, because I think I just read this last night. But the question is still relevant. I think I read that the virus seems to be mutating in Great Britain, and and whether or not I read that right or not, how concerned are you about the virus mutating, and can we quickly respond and create different types of vaccines for those mutations?
Yeah, as I mentioned, there's still existing questions about the vaccine. One of them is duration of protection. So it's a big difference if you have to get this vaccine repeatedly over time versus a single time or once a year, et cetera. So we need to answer those questions. And the other question, as you mentioned, is the possibility of the virus mutating. So how much cross protection does the vaccine offer across different variants of the virus? That's a question that still remains. So like if we have a mutation, how significant or substantial does that mutation need to be to no longer be covered by the vaccine? And that's not clear yet. So there are still questions out there. And again, the vaccine being available and the vaccine being rolled out doesn't mean that the questions and the investigations should end. We really should need to figure out all aspects of this vaccine. And the other thing we need to figure out is the substrata. Like what are there? Does the vaccine offer different protection and risks for different types of folks? Folks with different clinical backgrounds, underlying conditions, ages, demographics, those type of things.
Let me ask you a variation of a question I asked you earlier. And I think what you said, if I may try to paraphrase you, if I'm wrong, tell me I'm wrong, that it depends on where you're at as far as whether you get the vaccine or not. If you're a healthcare worker on the front line, you might be more inclined to get a vaccine. Is that a fair paraphrase? And if you were on the front, are you on the front line now? I know you're a healthcare scholar and healthcare expert, but are you actually working on the front lines now? And if you're not, if you were working on the front lines, would that figure into your calculation on whether or not to get it?
So I'm on the public health end, so I'm helping with the operations and planning and that type of area. So I'm not in a situation where I'm directly regularly seeing patients who may be infectious or contagious with the COVID-19 coronavirus, whereas there are people who are on a daily basis. And there are also people who are in situations where they don't have the personal protective equipment and those type of things. So So I think it's weighing the risks and benefits at this moment. Um, and so yeah, so certainly if you're in a situation where you're at higher risk, because we have to remember being exposed to the virus itself can carry significant risk.
Mhm.
So that may tip the decision making over on that side. Um, but you really have to kind of look at your individual situation to decide, at what point does it make sense to get the vaccine.
You're a healthcare expert, so I ask you a Monday morning quarterback question. How would you have rather seen our reaction to COVID differ than it has happened? Or do you think it just progressed the way it was going to progress anyway?
You mean the overall response?
The overall response.
Yeah, so we have to keep in mind, look at the different countries throughout the world. There's a significant difference in what's happened regarding the pandemic around the world. So there are some countries where it's very well controlled, and other countries where it isn't. So this isn't a situation where the virus spreading widely was inevitable. We know for years, we've known for years that there are many public health interventions that you can take, even when a vaccine is not available or a specific treatment is not available, to control the spread of the virus. And there have been countries that have done that, such as very extensive surveillance, testing, contact tracing, rapidly isolating people, or quarantine people when they've been exposed or test positive, social distancing appropriately, having reactive closures of places where if you know the virus is spreading someplace, then you might close locations in that area. I'm not talking about like full-scale shutdowns all the time, but what closing things when appropriate and then reopening when appropriate. Those are things that have been done in other countries and have not been done well in the United States.
Right.
We saw a long period of time in which people were downplaying the seriousness of, different political leaders were downplaying the seriousness of the virus and downplaying its threat and not really responding to the spread of the virus. You can't have that type of situation. And there's been many situations in our country where science has been bypassed, and politics and business agendas have superseded science and public health interests. We have to keep in mind that the road to any type of economic recovery is through science. It's through public health. If you can't control the spread of the virus, you will not be able to return to normal, and you will not be able to, quote unquote, recover economically.
Right.
Everything's connected, and that's been a big problem in our country, that there hasn't been that recognition. The other thing is, each of these steps needs to be approached in a very systematic, organized way. We can't have each of the different states do different things. There has to be a nationally organized strategy. It has to be coordinated, and it needs to be comprehensive. And even with the vaccine, we have to be careful, because I think one of the impressions is that, okay, the vaccine's rolled out, now everything will return to normal. That's just not the case. We have to be careful about the messaging, make sure people's expectations are realistic. And we also need to make sure that there's not the perception or optics that the vaccine was rushed in any way. And also, all these things need to be in place in terms of vaccine distribution and really understanding how these different things fit together. Distribution and supply and administration all need to be coordinated. And as I mentioned previously, there has to be organized plans on who should get the vaccine and who potentially should wait. And this needs to be driven by science. It can't be driven by politics. It can't be driven by other types of agendas.
Again, I'm playing devil's advocate. What do you say to the people who say that cumulatively our healthcare is making our healthcare worse as a country? The focus on COVID.
Yeah, that's been another problem with the response. Responding is not just responding to the virus and finding ways to control the virus. It's also developing new ways to deal with the potential consequences of having to make changes to sort of daily activities. Mm-hmm. So this is something that we looked at a decade ago. I remember during the 2009 pandemic when school closures were being considered. We ran computer simulations to determine at what point was it worthwhile closing schools, and we determined at the time it wasn't worthwhile because the cost would be too high. And at the time there was a vaccine on the way, and we're dealing with a different strain back in 2009 of the flu virus, so it's not like a completely novel. It's a new class of family of viruses or something like that. The COVID coronavirus is a coronavirus, but it is a novel virus that doesn't really have an analogous virus. So, but at the time we also determined that, okay, if you're going to do things like close schools and close businesses, et cetera, you need to have countermeasures to then compensate for the potential problems that may emerge from doing those different types of things. So you have to say, okay, well, how are we going to continue learning? How are we going to take care of the fact that maybe kids can't get school lunches and things like that? And the same thing applies for everything that's going on. There are ways to compensate. There are programs that you can set up to then take care of the folks who are then affected by these measures. Or like, for instance, if the restaurant industry is affected significantly by decrease in customers and hours and all those type of things, can you set up situations where the restaurant industry is providing food to frontline workers or providing food in different ways? These are things that can be set up, and we need to be much, much more adaptive and innovative about these things. Times change. Every decade times change. So the industries can't remain the same, and we need political leaders, et cetera, to help find ways to change, to help industries change so that they can adapt. So I absolutely agree that we have to think about those types of consequences. Even with healthcare, now we're seeing some more telehealth in reaction to this. So that's a positive development. That's a positive way of compensating for the fact that you may not be able to go to the clinic. That's just one example of how you can make changes to then compensate for all these problems that may emerge. So we have to remember that infection control and prevention is not just dealing with the pathogen itself, but it's dealing with the consequences and the downstream effects of what happens when you are dealing with the pathogen.
Well, I was going to ask you as a final question, any final thoughts for our infection prevention readers, but I think you just gave the final thoughts, unless you want to add to that.
Yeah, I want to reemphasize that it's so important to have science guide all the decision making, and this decision making is complex, and so you can't have decision making being done in absence of scientists, in absence of experts, in absence of people who really know the medicine and the science, because they're all interlinked. And one of the things that I've heard is, okay, there's separate lanes when you make these decisions. There's the economics lane, and then there's the public health lane, and then there's the infection control lane, et cetera, or however you want to divide it. And I strongly disagree with that thinking, because all of these things affect each other. As I mentioned, economics are affected by how well you're controlling the virus. The rollout of the vaccine should be driven in ways that, like, oh, who's the target population? Who should get this? And, how should it be rolled out? All of these things intersect. And I think we've reached a point in our society where a lot of decision making is just far too siloed and separate. And that all of these things really need to be integrated. And I feel that physicians and other healthcare professionals should have played larger roles in the decision-making throughout the pandemic, and should play larger roles in many other decisions in society going forward. We really need to leverage the expertise. You can't learn this stuff overnight. Like, you can't learn, like, if you have an infectious disease specialist who's been, who's trained for a number of years and who's practiced for a number of years, you can't replace that expertise. You need that expertise at the desk, the decision-making desk. so that you can make the right decisions. And the same applies for, public health experts and people throughout medicine and science.
Dr. Bruce Wiley, internationally known healthcare expert, thank you so much for visiting infection control today.
Well, thanks for having me, Frank.